Right, now let's get further analysis on this. We are now joined via Zoom by medical expert and CEO of Higher Health, Professor Ramneek Ahluwalia. Thank you so much, Prof, for your time this afternoon. 23 more cholera cases have been recorded in Hammanskraal, north of Pretoria, in just the last 24 hours. And of course, some provinces also confirming of cases. Should we be panicking, Prof?
It's a difficult question, Unati. It's definitely an outbreak for sure. And, what we need to do is to contain cholera, not to spread beyond Hammanskraal, and try to prevent it very quickly in Hammanskraal itself right now. And if we can contain the outbreak, and that's why it's called an outbreak, because it's in a very localized particular area within South Africa. And if we can contain it there and then we can limit the spread of the virus. So there's no panic in South Africa at this moment, but there's a huge panic in Hammanskraal at this moment, which means our health authorities, our systems and clinics have to be equipped to deal with the disease. It's a life-threatening disease, and we know that cases can deteriorate if not attended early when you have acquired cholera. So this means that considering that it's a life-threatening disease, we have to be absolutely very vigilant in Hammanskraal at this moment. And then we have to ensure that our water and sanitation system quickly takes over the situation to not allow the disease to spread to other regions, though in Tshwane as well as other parts of South Africa. So I think currently it's an outbreak, it's a panic in Hammanskraal, but not a panic in South Africa.
I don't know about that, Prof, because I mean a lot of people are starting to panic, even far further than Hammanskraal, including Johannesburg, of course. And I mean, what is of concern is that still the cholera outbreak source is unknown, whilst we know that, of course, that water tankers are being distributed in Hammanskraal. I mean, does this hamper in any way, treatment in terms of you don't know where the water source is or the cholera source is, I beg your pardon, but we are still, treating people by the dozens?
Well, Nati, you're right. So first of all, let's understand what is this disease. So I think let's educate that. So cholera is a waterborne disease. So it doesn't spread from one human to the other. It's not an airborne disease like we discussed in COVID, but it's a waterborne disease, which means a human who has cholera can spread through its feces. And when the water sanitation system or sewage system starts connecting to our and spills over into water drinking system or system which we consume on daily basis, and that's how the bacteria spreads from an individual to the other individual. So it needs a water source to do it. So the best thing, in any ways, it's always important for people to understand that to boil water is one of the best solution if we are worried in Gauteng at this moment, because yes, it's absolutely surrounding us, it's close by to us, people are moving among each other, and the aim is requesting people to wash their hands after using toilets. It is very, very critical to use boiling water for now. It is also very critical that when you are cooking food, you try to eat not half-cooked food, but properly cooked food, trying to ensure that you use boiling water when you're cooking, or properly cooking will kill, because heat is one of the good solution of killing. The other solutions are, if you are in Hammanskraal, or if you are in an area where sewage or sanitation systems have been a challenge, then the important part is when you boil the water, you start drinking boiling water, and then when you use the boiling water, you need to ensure that that it is not standing for 2 days, because the bacteria can still survive back. So drink it in 1 day, replace the boiling water once again. Use bleach in 25 liters of water. You can probably use about 5 ml of bleach. Keep it for 2 hours. The water does purify from there on. Try to use filter. These are mechanisms to overcome a kind of an outbreak if it is very surrounding to your area. I still believe that our sanitation system is very strong. It has shown a weakness in a particular outbreak area, and that is why I think the authorities are trying to put cleaner safety and purification systems of water usage by the municipality into the area. And I think that as soon as it contains with absolute disinfectants being put together into our water, which is chlorine and others, will then overcome by the bacteria not moving as freely as it is moving at this moment in that area. So I think these are important public health awareness systems. Repeat again, wash your hands after toilet. Make sure you're using boiling water at this stage. Do not eat uncooked food. Try to eat fully cooked cooked food, whether you're eating fish, meat, or vegetables. And I think using clean water system is a very big solution at this moment.
A lot of the problems that we are currently seeing, particularly as it relates to water quality in South Africa, has been blamed on just the governance in terms of how this has been addressed. I mean, whilst this is ongoing, how difficult will it be for South Africa to prevent this in future if our water systems are in question at the moment?
Cholera has always been endemic in all these countries where the sanitation system and the sewage system is not proper. So any municipality in South Africa where we have sewage system issues, sanitation issues, that needs to be resolved, because it's not just the cholera outbreak. It is basically going to be all the waterborne diseases that spreads will become more predominant in our nation too. So South Africa did not experience such challenges that remains endemic in many African and Asian countries. But we have to be vigilant. This has come into our system. It is clearly showing a small weakness in our current systems of sanitation and sewage. And we need to really overcome that through a proper water purification system that we have throughout been very proud of. We need to really go back to the drawing boards. And so it's a public health system where it has to work very closely with water and sanitation system and ensure that service delivery is appropriate, because that's the only way you can remove the waterborne diseases.
Prof, thank you so much for your time. Really do appreciate your analysis on the show this afternoon. Professor Ramneek Ahluwalia there is the CEO of Higher Health and also a medical expert.